is by Hochschild. It's called King Leopold's Ghost. And in those books, they talk about things that we have access to every day. You drive a car, your tires are made out of rubber. Your kids ride bicycles, their tires are made out of rubber. Where does rubber come from? There are no rubber trees in the United States. You can go from New York to California. Rubber came out of the Congo and came out of Liberia. And so companies like Firestone and Goodyear were in cahoots with the monarchs that they put into power. When I was in Africa, that ball on the west coast of Africa, they used to call that the Gold Coast because there was so much gold there. When I went to South Africa, they took me to the place where they found the Kimberley diamond. They had to dig a hole that was about as big as this room. So you have rubber, diamonds, gold, palm oil, all these precious materials and resources. And then the people. And in the words of Randall Robinson, who used to be the head of TransAfrica, you can't put a price on that. It's incalculable. When people talk about reparations, you can't account for the bazillions of dollars that were taken either through the rape of the resources in the continent or the exploitation of the labor via the slave trade or in colonialism. Now, we call people different things. And since I worked in media, I'm kind of a wordsmith, and I pay attention to words. And so when we say the slaves did this or the slaves did that, I started to think, I don't like that term, the slaves, because it sounds too much like the tables or the chairs. And we forget that these were human beings. And so it was important for me to start to refer to people as the people who were enslaved or the enslaved people. So if Andre, or if you could do me a favor and hold this for me, I would appreciate that. If you could hold one end and if you could hold the other. We have to remember that these were people. So imagine, if you will, he was the hunter who captured the boar. She sewed the outfits the school children wore. These three are Igbo, experts at trade. He was so proud of the drum his son made. She was a queen. Don't take her to task. And we Bamaleki wore the elephant mask. He wore the tall stilts with the boo-gara-boo. And at the market, she'd say, no, buy one, you buy two. Bambara, he said, God come from seed. Fulani, she take only just what she need. For him to be quiet, there must be a plot. And these three over here, they argue a lot.
Jennifer, you still on the call?
Oh, very good. Thank you. She had a smile as wide as an ocean. He'd heal your body with herbs and a potion. A champion wrestler, he had nothing to prove. Guinea Girl was a dancer. Now she hardly can move. Iron replaces her bracelets of gold. For 12 rifles, her whole family was sold. She just cry and she cry. We believe she was raped. She wonders if her little brother escaped. The people who were enslaved. We could go on and on. and just imagine what lives they had in their respective African villages. But we don't know. And our history doesn't tell us that. Thank you so much for doing that. So one of the scenarios, if you were listening, I said one of them was a healer. He could heal your body with herbs and a potion. Some of you, since you're medical folks, might be familiar with a book that was written some years ago by a gentleman named Plotnick, who went into the Amazon rainforest and wrote a book called Tales of the Shaman's Apprentice. And he was a medically trained doctor, went through, I want to say, Harvard Medical School. And he spent some time in the Amazon rainforest among shaman, natural healers, and he threw out the window everything that he had learned in the textbook. And his book is about different herbs and teas and natural ways of healing. And what comes through in the book is a respect for the indigenous people's wisdom. And that's very important, because what happens when people invade another place and take over is they devalue the wisdom and the knowledge of the indigenous people. It happened with the Native Americans. It also happened with the Africans. And so, since we're talking about healing, we have to, I'm glad Bernice is here, think about psychologically the healing that is required, not just for the victims of these atrocities, but for the perpetrators as well. And I believe that the healing starts with an understanding. So we have to discuss these things. We have to have truth. We have to have reconciliation. We have to confront what happened in the past and learn from it. One of the symbols that I have is just that. If Lamar Anderson was here, he would tell you what this bird stands for. It's a Sankofa bird. And the bird is going forward but looking backwards. So as you go into the future, you learn from the past. And that's the idea, is what can we learn from the past? When I talked about the Congo and how King Leopold got this man named Stanley, remember Stanley and Livingstone, to go into Central Africa and basically just take all of that land, get these people to sign bogus treaties. When they started to colonize this area, the Africans were responsible for getting a certain amount of rubber. And if they didn't get a certain amount of rubber, they were dealt with very harshly, but not in a way that would keep them from being able to get more rubber. What they would do is they would take it out on their families. And there's this horrible picture, and you could probably find it online, of a man sitting, an African, looking at these two objects in front of him. And it's a very pensive profile look. And you wonder, what are those two objects in front of him? And in the caption, it says, the objects are the foot and the hand of his 5-year-old daughter. So they had amputated his children's hands and feet as a punishment for him not getting a certain quota of rubber. How do you recover from that? So it is obvious that the perpetrators, the colonizers, the oppressors who came upon these folks devalued them as human beings. And that was the justification for their enslavement. If I regard you as a human being, as an equal, it's very difficult for me to treat you poorly. But if I consider you something else, not much more than an animal, then I can deal with you however I want and have no pangs of conscience. So to segue now to our panel discussion, check this out. 1851, there was a journal that was written by a gentleman named Charles Hamilton Smith. And this was a widely published medical journal. And it said, the title was The Natural History of the Human Species. And one of the biggest things that he postulated in this journal was that, quote, Black people do not feel pain or anxiety. This was 1851, so slavery was still in effect. Black people do not feel pain or anxiety. So if I have him on the plantation and he does something, that goes contrary to what I wanted him to do, and I whip him or beat him or starve him or rape his wife in front of him, I don't care what he thinks because I don't regard him as being human. There was a letter that was written to Dr. Du Bois, W.E.B. Du Bois, in the early 1900s from a gentleman who was doing a study, and he wrote, and I'm paraphrasing, that we are doing a study on the range of human emotions. And we were referred to you as someone who would be knowledgeable about Negroes. And we are interested to know specifically whether the Negro sheds tears. We want to know whether the Negro sheds tears. And the last two, actually I have three of them, two that you're very familiar with. One is the Tuskegee experiment. We know about that, so I'm not going to spend a lot of time with that. Just to remind people, that went on for 40 years. That's a long time. 1932 to 1972, that's a long time, 40 years. And for a disease as vile as syphilis, for men to be walking around with that kind of condition. And we know about Henrietta Lacks. I think, since we have the Minority Business Development Center and we're encouraging people to go into business and develop their businesses, and we sometimes we think of things in business terms. The fact that Henrietta Lacks's cells were harvested without her permission and were used in research, which conceivably, I'm sure, led to some discoveries and cures and et cetera, et cetera. The fact that she did not benefit from that at all is compounds the issue. Scientists, without her consent or family's knowledge, harvested her cells for medical research. In 2016, which was just 5 years ago, 4 years ago, 5 years ago, it's 2021. Thank goodness 2020 is over. University of Virginia had a survey of 200 white medical students. 40% of them said they thought Black skin was thicker and thought Blacks felt less pain. That's 2016. University of Virginia. So that continuum of devaluing people, where are we on that trajectory? Is it going down? Is it stable? Is it plateaued? Where is that? This is 2016. Now, let's talk personally. I have friends. You got friends. We have Black people here. I had a young lady who was a dear friend of mine. She passed away. She had cancer. She went to her gynecologist. She said, Gary, after 25 minutes, I had to get up and leave. I said, well, what happened? She said, they got me undressed. They put me in the stirrups. And then they left me there. 5 minutes, 10 minutes, 15, 20, 25. And by the time they came back in, I was dressed, and the nurse said, well, what's going on? She said, I am not a car. I am not a car. So in addition to some of this institutional grid of devaluing people, you have the common everyday informal interface that all Black people experience in a range of social settings, whether it's Andre Allen, who's an administrator on a Saturday morning, putting on his sweats and going to the grocery or going to a store and being followed. Et cetera, et cetera, et cetera. So in America, it becomes layered, and we have to go back and reconcile this whole concept of reconciliation and atonement and confronting these issues. It's important if we are ever expected to grow out of that. We have to, at least at first, look at people as being equal. So last point I wanted to make, which was something that was disturbing to me, and somebody told me about this, and this could be a conversation topic. It's not too much off subject, but DeMarcus, somebody told me that when Black people fight for equality, to us, it just seems like, a natural thing. We want equal access. We want same kind of housing. We want the same kind of this. We want equality. They told me that for white people, that is a step down. And I had to wrap my head around that. That the reason why you get the pushback is because for the average white person, if they have white privilege, and many of them don't know it, or if they are benefiting from this system of inequality, then why would they want a system of equality? Right? So at the radio station, and I'm sure you experienced this, I had a young lady come in, Gary, I don't know about the vaccine. I don't know about the vaccine. You know what they did with Tuskegee? You know what they did with Henrietta Lacks? You know what they did with blah, 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 blah. And I'm like, yeah, I know, but we need this vaccine. Yeah, but they still, and I said, you know what? Black people have never had good decisions. Do I jump off the slave ship or do I stay on? Do I run away with Harriet or do I stay on the plantation? We've always had horrible decisions. Okay, but now this is something we need. We need this vaccine. I understand your cynicism, your skepticism. And so I had her listen to an interview that I had done with Dr. Naala. And she explained how, yeah, they had Tuskegee, they had Henrietta Lacks, they had all these different things. And she said, but this vaccine, it's been thoroughly vetted, the studies are widely published, the clinical trials, they use Black people, et cetera, et cetera, et cetera. And so I had this young lady listen to that. And after she listened to it, and I said, okay, now what do you think? And she said, well, I don't know, I'm still kind of skeptical because this came out during the same time that Bill Gates came out with the chip that he was going to put in us to change our DNA by using 5G. I got nothing. So now, unfortunately, we live in a time where he puts out a narrative on Facebook, gets somebody to co-sign it, get a couple hundred likes. It may not be true, but that's what's out there. So we have to find a way to cut through all of that to arrive at the truth, and then have people accept the truth. Pretty tall order. Thank you for listening. I appreciate it. We're going to bring up our panelists.
Let's give a round of applause for Garry Moore. So what we're going to do a quick shift change. We're going to bring our panelists up. We're going to grab some chairs for them. And then Garry Moore is going to introduce them. And then we're going to get into some dialogue. As I stated in the chat function, if you have any questions, comments, concerns, or anything that you want to contribute, please put it in the chat. And I'll try to relay those messages to Garry and the panelists as we are having some dialogue. So we'll get started in about 2 minutes.
Your own chair. Oh, thank you.
Good job. Appreciate you.
I do. We are. I think we're ready. I'm going to read the full bio from these wonderful folks because they deserve it. Elaine C. Hardy, PhD RN, is a clinical assistant professor of nursing at the University of Illinois at Chicago in Peoria. She teaches health equity and social determinants of health in the graduate program and is the faculty mentor on projects for several DNP students. She collaborates in research with students and faculty, as well as mentoring of faculty, students, and nurses. She received her ASN from Purdue University, North Central, BSN from Indiana University Northwest, MS, clinical nurse specialist from Purdue University Calumet, and her PhD with a concentration in women's health from University of Illinois in Chicago in 2011. Her research stems from her interest in the disparities in health experienced by African American women and physical activity, which has led her to research in lack of diversity in nursing. That is Elaine C. Hardy. Bernice Gordon-Young is a master's level licensed psychotherapist. She is employed at OSF St. Francis Medical Center, where she counsels children, adolescents, and their families. It was there, combined with a previous dual career working as a 911 dispatcher for the Peoria Police Department for nearly 20 years, where she learned the true challenges people face, and she acted. Before COVID, she facilitated self-management and recovery training courses in group settings at the Peoria County Jail to assist inmates in decision-making and resources. In addition, she provides counseling services to individuals on federal and state parole and probation in her private practice. To support the surge in mental health challenges associated with pandemic fatigue, she also counsels men, women, and children around the globe through telehealth. Bernice Gordon-Young is the founder and president of It Takes a Village of Peoria Incorporated. That is a not-for-profit organization founded in 2016 and is aimed at assisting students, their caregivers, school personnel, and area organizations by providing free items, including school supplies, clothing, toiletries, food, furniture, and numerous items to improve overall well-being. Ms. Gordon-Young does numerous speaking engagements on topics such as mental health awareness, self-care, and empowerment. She is a doctoral candidate and will earn her PhD in counselor education and supervision with a specialization in forensic mental health this year. Her research efforts include ADHD and the misunderstood child, internalized oppression in the African American community, stereotype threat, and Afrocentric perspectives through the lens of incarcerated African American men. Ms. Gordon-Young serves on numerous boards, committees, and panels ranging from health awareness to violence prevention. She has received numerous awards for her work, including the WEEK 25 Women in Leadership Award. And there's a whole laundry list of awards. Ms. Gordon-Young is married to Trenton Young. They have 3 children. She lives by the scripture, if you have faith, even as small as the size of a mustard seed, you can accomplish much. Mrs. Gordon-Young has extreme faith in her community and believes that we can accomplish as much as we would like, so much more when we work together. That is Bernice Gordon-Young. DeMarcus Mark Supreme Hamilton is a cultural commentator, media practitioner, and street educator. He graduated from Peoria High School, matriculated through ICC before obtaining his bachelor's degree at Southern Illinois University and his master's degree at University of Illinois Springfield. Since then, he has traversed the country to capture the hottest interviews and stories of urban culture of the United States in real time to report back to the people of Peoria, Illinois. He now serves as program director for Strictly Hip Hop 90.7, which he started with DJ Lavish in 2010, and also contributed to the Peoria Journal-Star, hosting State of Peoria alongside Chris Kiergaard, covering Peoria politics. That is Marcus Hamilton. And Colby Slaughter is a senior at Methodist College, pursuing his Bachelor of Science of Nursing with a minor in Diversity, Equity, and Inclusion Studies and a certificate in Community-Based Primary Care. A Bloomington, Illinois native, he received his Associate in Arts with a concentration in Nursing in May of 2018 at Heartland Community College in Normal. Nursing has been a passion of his since he was a junior in high school. Colby has always known that he wanted a career where he could help people, his community, while at the same time being a role model for making healthy lifestyle choices and by providing education to underserved populations. In addition to going to school, he has also worked at OSF St. Francis in the emergency department as an ED technician. After school, he plans to continue to work in the emergency department at OSF as a registered nurse. Eventually, He plans to continue his education to the doctorate level of nursing practice and become a family nurse practitioner. He's very proud of his academic success at Methodist, and aside from academic success, the passion he has for nursing is what motivates him to one day become a nurse practitioner so he can provide comprehensive care to individuals and families. So those are our 4 panelists. Let's give them a round of applause and thank them for being here. So my first question to anyone who wants to start, I'll start with Bernice. If offered, will you take the COVID-19 vaccine? You are vaccinated. So that cow has left the barn. Or did you take the 1 shot or the 2? The 2 shots. And feel good. All right. And why did you decide to take it then?
I'll take up the side effects. Not, dying and all these other catastrophic things that
DeMarcus?
Can you hear me?
Yeah.
So have I taken it or will I take it?
Would you take it?
Would I take it? I'm not sure. I'm not at that space right now. I come from a mother's a nurse. Josh believes she had her vaccine. She's a heavy believer. Probably one as well. But I used to take the flu vaccine like last time I had it was in high school. But I'm just not big on medicine in general. I woke up with a headache today. Not big on medicine.
Okay.
Not saying I'm opposed, but you gotta hold. Okay. Not saying there's no chance I would, but I haven't considered that just yet.
Okay. Colby.
Is this okay? Should I
Sure.
grab it? Yeah, I've taken the vaccine. I've received both doses.
And why?
So, as you said, I work in the emergency department. So, I've seen firsthand the negative consequences of COVID-19.
Such as?
Dyspnea, shortness of breath, fatigue, chest pain, blood clots, resulting in hypoxia and having to be on a ventilator. I've seen families grieve for loss of loved ones because of COVID-19, and being around that environment during the pandemic and then planning to be in it even after, like when I graduate as a nurse. I want to protect my community and my family, so I decided to get vaccinated.
Dr. Hardy?
Yes, I have received the vaccine.
I assumed you would.
Although it wasn't offered, I guess I'll take this off. Sorry. I had to wait till it was offered. And that's one of the barriers that people are experiencing. If you're not a certain age group, if you're not in a certain, because I don't work clinical, so I'm not around patients, I had to wait until it was offered to me. And so I did take it. It was funny because my husband's like, "Can I get one?" And I asked, and they were like, "No, he's not in line because there's so many other people through the university." But yes, I received it. And the reason I received it is because, well, first off, how can I ask somebody else to take it if I'm not willing? And then the research behind it and the study behind it is that it works. I get the flu vaccine every year. I have not had the flu. My husband got the flu last year or 2 years ago. He actually was late on his flu vaccine and he suffered. And if you, I'm like, I have not been exposed to the flu. And the way he was, it's like, why wouldn't I take it? Usually he gets it, and so he makes sure that he gets it. So it really is a matter of not just protecting yourself, but protecting others. I do have siblings. I have young nieces, nephews that I want to be around. And I haven't been around anybody because I'm trying to be protective and responsible.
I'm
So-
curious to find out what you think about the protocols, because you mentioned your husband wasn't able to take it. And I think we're at 1A or 1B with the protocols. Some cities have considered moving African Americans up on the protocol. So what I'm talking about is, like right now, if you're 65, then you can get it. But there's this consideration in light of the fact that African Americans are dying at a rate of 2 to 3 times as whites, and et cetera, right? That maybe from an equitable standpoint, the African American community should be moved up on the protocol. What do you think?
I agree. I mean, we talk about access, and it isn't always that people are hesitant about taking the vaccine. It's not accessible. If it's not in your neighborhood, if it's not where you live, how are you supposed to get it? And so if they're bringing it to other neighborhoods or it's only in certain areas, Black people aren't going to get it. And so availability, not always accessibility, is the problem I think that we're experiencing. So definitely taking that into account and then making sure that it is available to people. I was talking to, I can't remember who I was talking to. I think it was another town hall. And the gentleman said that in Europe, they're actually doing round the clock. So you can come in at 11 o'clock at night, you can come at 2 o'clock in the morning, they're giving the vaccine round the clock. If it's that available, if it's that accessible, I believe that people would get the vaccine.
Mm-hmm. Bernice, I see you shaking your head. Why don't you just keep that?
You know, I shake my head because I think about, this is about civil rights as well. It is about, historically, we fought for access. And now that we have access, it's important to make sure that it is equitable. And, I understand there's a hesitancy within it, but, whether it's in our neighborhood or if we need to travel for it, we'll find a way to get to where we want to get to. And, again, but on the other end of that is there is going to be soon 100,000 vaccinations administered a day. And so I'm optimistic and looking forward to those days as well.
Mm-hmm. One of the concerns, this is kind of inside baseball, is that when we had the testing site available at Carver, as you know, there were a lot of community folks, elected officials who I may know, who pushed to have access to the testing. And unfortunately, a lot of people didn't take advantage of it. It was well publicized. It wasn't that people didn't know it existed, but when they would have testing in our community, it was there, but people did not take advantage of it. I'm curious just to have your thoughts as to why that is. Is that a part of this, we've been smashed so much, this society isn't for us? Is that the reason for the apathy?
Well, I think at first people were afraid. It looked pretty painful.
Oh, with the up the nose?
Yes, it looked pretty painful. I think that was the initial reason. But then there's a stigma with COVID. People who have had COVID, people stay away from them or look down on them, and we have to really get away from stigmatizing things and understanding that it can happen to all of us. I know people who work from home, didn't leave home, and still ended up with a positive coronavirus test. So, that's one reason I think why people didn't attend or go.
Dr. Hardy?
Yeah, I think another reason is education. There was so much misinformation. Like you said, if you put it on Facebook and 10 people like it, it's the truth. You know, we used to talk about Wikipedia not being the truth. Now it's like, okay, Twitter, and we have so many different venues that people are running to instead of actually running to physicians, running to people who are knowledgeable with the information and who are willing to share the information. So I think a lot of it is a lack of knowledge, and then fear. So, you know, the stigma of a lot of diseases is a problem that we suffer from. People have stigmas about cancer. You know, if I drink behind you, I might get cancer. You know, and this is misinformation. So we in the healthcare profession, we really have to dispel that with the truth. And so, like I said, you know, getting the vaccine, yeah, I can tell you my arms hurt, but I kept going. You know, you still have to keep moving. But I know that if I do have COVID, it should be at a lesser degree than if I did not have the vaccination. So just that knowledge and then just getting the word out and informing people, you know, I think that's most important.
Yeah, I agree with everything that's been said. And in addition to that, I think we've talked about it previously about the Tuskegee study, but we have to recognize that the United States has a dark history of providing quality healthcare to the Black community. So I think one part about our healthcare system that failed the Black community is rebuilding that trust back. I don't think we've taken the proper steps to do that first before pushing out any type of rollout for the vaccine about getting it or education. So I think rebuilding the trust within all minorities in the United States is a huge factor when we consider having people get the vaccine and be more optimistic to getting tested and removing those stigmas related to COVID.
Dr. Hardy, you mentioned education, and the next question, what are the best practices to combat vaccine hesitancy within the African American community? And when you say education, I'm thinking you're not talking about when kids go to school, they're taught. You're talking about meeting people where they are. What I hear is maybe when I go to the barber shop, there's a poster up. When I go to church, the minister is talking about it. Whatever platforms we have, of us who are in the know, we put the correct information out there.
And I like the way you said correct information, because you can go to the church and get misinformation. You can go to the barbershop, and that's like going to the bar where the, I always equate it because people feel they're
Okay, now
close.
wait. You don't talk about the barbershop. I don't talk about the beauty shop.
Well, I was
Okay.
going there too, but that's where you spill everything. So if misinformation is given at the beauty shop, at the barber shop.
Yeah, say beauty shop.
Then, okay. Then that's the information that people are going to run with. And so definitely having correct information in those venues, meeting people where they are is very important. So if people are going to the grocery store, have that information there. Have somebody from healthcare there advocating for the vaccine, giving education about the testing. But that's where the education comes. Even teaching your kids. I mean, they get immunized. We immunize our kids from kindergarten through high school, and then after high school, we stop. You know, we don't push it as the flu shot. We don't push it as the DTaP. I'm sorry, the tetanus, diphtheria, that vaccination. We don't continue to get vaccinated after high school. So when did that stop? So that's another piece of education that we as adults need, because we need to continue in healthcare. And most of that becomes preventative as opposed to I have a problem and I need to be seen.
Mm-hmm. What have you heard, Marcus? I mean, what have you heard what I've heard about the 5G?
Yeah, I mean, I think anybody been on social media, somebody mentioned. Somebody has seen somebody. I've come across it, not a ton, but.
And what do you say to people when you know they have the wrong information? Like when they think LeBron is the best when you know it was Jordan. I mean, what do you?
We shut those things down immediately. But I have yet to come that suggests that 5G has anything to do. Anything that I saw on social media related to 5G is saying how crazy other people are for thinking this is a part of.
We're going to actually just pass the mic around. Okay. And then we'll bring sanitize later.
Okay.
Okay.
So yeah, that's what I've come across.
Yeah. Next question. How do we make the healthcare system more equitable for the African American community?
Who's that goes?
To make it more equitable, I think one important concept we have to consider is representation. You can probably back up this quote, but I found that there's less than 10% of registered nurses that are Black in the United States. So I believe if minorities are more represented in our healthcare systems, that participation and attending doctor's appointments and being more, what's the word? Lost the word. Being more like following instructions post-discharge for the Black community would increase if it's represented equally.
All right, and I'm going to play devil's advocate with you. All right, because it was a Black doctor and a Black nurse that really championed the Tuskegee experiment. So you had representation, but they were on the wrong side of history. So besides having representation, you have to make sure they have proper conscience.
Correct. Yeah.
I think it's really about advocacy. When somebody doesn't know or they don't have a voice, you have to be that voice. So definitely ethics comes into it. And after Tuskegee, there are a lot of things that have been put in place, institutional review boards to look at studies and trials that are being put in place to make sure that they're not harming humans, human subjects. And so I think that's a big thing. But I think in the healthcare, having a conscience, absolutely, doing the right thing. And if you know better, you should do better. I mean, those are simple things, probably things we heard as kids, but we don't always do it. And so following along just because it's easy or just because that's the way it is, sometimes you have to speak up and buck the system. And when you know it's right, you have to speak up. So I believe that's advocacy for me, that's speaking up when patients don't have a voice.
Bernice, I asked you this question before on radio. Are you optimistic? It was horrible what happened to George Floyd and Breonna Taylor, but coming out of that, we started to see a lot of stuff. A lot of it was symbolic, things that were done on the part of institutions. They got rid of Aunt Jemima, stuff like that. But there was this spirit of, okay, this is a moment, this is an opportunity. You have a president who said in front of God and everybody, Black community has always had my back, so I got yours. Do you feel optimistic when we talk about these things that we've always talked about? We need more access, we need equality, we need equity. Do you feel optimistic that we can actually do it, that we can actually achieve it?
I think we're making progress, and there's momentum. We have to understand that this isn't temporary. This is throughout the span of our lives and our children's lives. And I also agree with what's been said in terms of, regardless of whether it is our physical health, our mental health, it is about do no harm. When we sign up for these positions, these titles, these jobs, it is about do no harm and practicing with cultural competence. That's a huge piece. You don't have to be African American to treat African Americans correctly, but you certainly need to be culturally competent. And so that advocacy piece is important. It is important to be a gatekeeper to the profession and to continue to learn. We're all in a space of learning. We need to learn about the vaccination, make informed decisions, ask the questions. And often people don't know what questions to ask, so they don't ask any. And so that's where the education piece is important for us to continue to move forward.
I really appreciate what you were saying about you don't have to be African American in order to be able to empathize, especially if you're a medical professional. I know a doctor at OSF who has a lot of Black patients. He's a white male. And he said over the years, his patients have taught him to be a better doctor in terms of being empathetic to their concerns. He's learned more about hypertension and what triggers high blood pressure, their triggers from them.
Absolutely. I always say this as well. When we work in public industries, we need to travel to the areas of the patients in which we are treating. If I've never been to your neighborhood, how do I know how you live? Meaning what the environment is like, what the conditions are like. I don't have to go into your house, but I definitely need to see your world.
Mm-hmm. Mm-hmm. You want to add something to that? No. Okay. All right. That's right. All right. I thought you were. Okay. So yes, when it comes to cultural competency in radio, Mr. Hamilton and I think, call that cultural relevance. So let's say the health department or somebody has a PSA to discourage smoking, and they send it to us. And on the PSA, there's a white guy's voice saying, you know, smoking can cause emphysema and lung cancer and blah, blah, blah. And you should, you know, eliminate this and blah, 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 blah. And what we do is we'll take the script of that and we'll have Deontay read it, right? You agree?
Yes, for sure. That goes back to the question you posed with how do we increase education amongst the Black community when it comes to the COVID vaccine and anything else. You definitely want to figure out how to be culturally relevant to the audience that you are, in a sense, pontificating to. And I did that with the vote. Like I didn't have, not even me, I didn't get on there and say, hey, you guys get out to vote. And I had somebody that I know from the streets that said, hey, get out and vote now. You know what I mean? And people can relate to that. And I forget what the term is for it. And this is a little bit slightly outside the scope, but I forget what the term is, but there's been studies that show that having people endorse something that everybody can relate to, it helps sell products and it helps sell ideas and information. A quick story, everybody know who Lil Wayne is. Everybody know what Beats headphones are. So when Beats headphones was getting ready to come out, they were getting ready to roll out the marketing, and they were trying to figure out how much time to allot for a commercial program during the All-Star game. And they're trying to figure out how they're going to market the Beats headphones and what they're going to say and the different camera angles of the headphones and things like that. And somebody in that room was like, hey, you know what, instead of spending all this money, how about, I know Lil Wayne, he's going to be at the All-Star game, he's going to be in the front row. How about we just pay him to wear the headphones, put a bunch of diamonds on it because the camera's going to go to him anyway. And then when people find out what those headphones are, everybody's going to want them. Damn. And so just leveraging the celebrity status, even locally, the Garry Moores, the Bernice Gordon Youngs, the Andre Allens, you know, we can leverage, we can reach out to these connectors, and you know, if we can get them to buy in on the idea that the COVID vaccine is healthy, it is safe, and it is beneficial for the society as a whole, and have them endorse it, then the people that follow them hopefully will buy into the idea as well.
Yeah, you know, I'm curious. We don't have a white person on the panel, and if you don't mind, I'm curious to hear from one of you about this issue of cultural relevance or cultural competency. And I'll give you another example. When Heartland first opened its office on Wisconsin, I want to say my mom was still alive and she was living in the East Bluff, and the Kroger was still there. And I remember going in there and it was all Black patients waiting. I think I was there on business, but I just happened to look on the table and I saw Cosmopolitan, some other white magazines there. Okay. Now I had a cousin in Tennessee at the time, and she had a subscription to Ebony and Jet, and she was actually, she had suffered a stroke and she was in a nursing home and wasn't able to access those. So these were just piling up. And I took them to there and asked the receptionist, would it be okay to leave them there? And she said, oh yeah, sure, sure, sure. So whenever she got her new additions that month, I would bring them there. I'm thinking that made those folks who were sitting around there feel a little more like the institution respected their existence, right? Or was trying to relate to them culturally. Do people get that?
I think that some people get that, and I think that some people don't. Something that Corey said, I was thinking about me personally. I can tell you personally, I want to educate and assist everyone, but I'm a nurse, and that's how I feel like I have always practiced. It doesn't, to me, I didn't care. I just wanted to help that person, whatever that meant, and I didn't even care how that person got what they got. I mean, when you're talking about some things, I just wanted to help them, and so that's how I feel, and I want to help. I do recognize the fact that I probably don't have the face to meet everybody's needs. So yes, I think it does matter. I think many people actually don't get it, and I don't know if it's a conscious thought or if it's just they don't think about it, as opposed to being a conscious, malicious thought. Now, maybe they should be thinking of it consciously, but I just think it's because people just don't pay attention. And I don't mean that in a mean sense. I just think a lot of people don't pay attention. And so things go by them, or they're not giving thought to what they're doing. Or I sat on the board of Friends for many, many, many years and realized that I want to do this because this is a great thing. I'm not going to be able to reach a lot of the people that I need to be able to reach.
So is it like in any profession, you learn the science of the profession? So you can be this excellent heart surgeon, the top in your class in terms of being able to do ventricles and arteries and stuff, right?
Yes.
Okay. But you have horrible bedside manner. And so where is that taught? And so if bedside manner is taught, I'm sure that is by now, before you graduate, they teach you about bedside manner. So are we talking about, in addition to that, you should be taught some kind of cultural sociology, relevance? Would that make a difference? Does that make sense?
No, it does make sense. And I think it is a responsibility of the college, certainly, to provide as many opportunities as possible to tell the stories of many different types of people. For me, I address COVID here with the students on a pretty regular basis. And it's been extremely important to share the fact that when you bring up Henrietta Lacks, her immortal cells were used in the creation of the COVID vaccine. Mm. To me, it's celebrating, that sacrifice to be able to take the vaccine. It continues that remarkable story forward. So I think that certainly is a piece that can be used to promote it within the African American community. No doubt, I think if you do understand the history of what has occurred, particularly bring up things like Tuskegee, you absolutely have to understand why there is fear. But I think fear in general for everyone is what has kept people away from perhaps vaccinating when that opportunities come up. We have students here who have had the opportunity to vaccine who have not taken the vaccine because of concerns, and race has not always played a role in that decision.
Okay. Andre, I'm sorry.
Well, I think that's the importance of implicit bias training for all professions, is that we all have to understand these built-in biases that we have, where they come from and how they affect others, because it's pervasive. We see it in our police force, we see it in our healthcare system, and without implicit bias training, I think that we are missing a huge component of what it means to understand where we come from and where our opinions and where our values come from, and what that means to other people. So I think there has to be that steer towards implicit bias training.
Yeah. If anybody else has any questions, you can raise your hand. I'll give you the microphone so you could ask the panel. You wanted to say something?
I'm sorry, you got to turn. One thing that I thought about too, though, was we're talking about education and educating people on medicine and things like that. But I think, and I don't speak for everybody in the Black community, I am speaking for me and people that I know and people that they know. We've had these discussions. But education is a part of the reason why people are having trepidation about the vaccine. When people, so overall, I think you have a couple things happening in the Black community. First of all, and y'all can agree or disagree, but we're starting to go cleaner on our eating. We're starting to clean up how we go about taking care of our health and managing our health. And then when we do our research and we see about, John D. Rockefeller and how he put forth allopathic medicine and tried to kind of extinguish any idea of holistic approaches to health. And then we go to, our doctors and we say, hey, we're trying this herbal supplement. And they say, what? You want to take this pill, you want to take the synthetic piece. And then we have grandparents that are taking pills and taking other pills to combat the side effects of other pills. And then that's all in a homogeneous mixture that goes on for years and years and years. And so when you take that into account and how people are trying to get away from medicine or the synthetic drugs that we've been given and explore other options, I think that's another reason why people are apprehensive when it comes to the vaccine.
Yeah. Question? No. Okay. Well, no, you can keep that. Okay, so now let's go back to this issue that's going to come up again, like next week, and that is the first issue that we tackled. Do we want to have African Americans as a part of the protocol in light of the statistics that show we are dying at a rate of 2 to 3 times that of whites? Do we pitch that to the health department, to the governor, so that that is the new protocol?
It's important that we do pitch it. The thing is, we can change policy, we can change the direction, trajectory of healthcare by being a part of it. But so often we stay on the periphery and we really don't have a voice in the vaccine. Absolutely. I think Bernice was talking about the social determinants of health, where you live, your zip code matters, what you have access to. And so often, you tell patients, go eat healthy, you need to buy green vegetables or whatever, but there's no grocery store in your neighborhood. There's no grocery store anywhere near you. So how are you supposed to access that? So same thing with healthcare and same thing with the vaccine. Yes, the government needs to put it in, and it needs to be given by people who look like the people who are taking it. I'm not from Peoria, but I can definitely talk to anybody in Peoria. And I think it's important because it's hard to relate. And I think somebody in the audience was saying that, for herself, she believes that, but does everybody? Implicit biases, they tag along with all of us. I think we all carry our own knapsack of biases, and until we're actually faced with it, we don't always know that we have these biases. So having to address them is one of the things. So being called on it, and that's that responsibility as a faculty member. I have to call people on that. When I see something, I have to call it. But the other thing is that makes you more sensitive, because now I'm going to be more sensitive to patients and I'm going to be more sensitive to their plight.
And it's okay to be sensitive.
Oh, definitely. I'm human. And that's what we lead with. We are human, and that's what we're taking care of. We're taking care of other humans. So yeah, I definitely agree that we need to look at where this Medicare or where the vaccine is being given. Sorry, I'm not like where the vaccine is given, what neighborhoods it's being given, and then bring it to the Black neighborhoods, bring it to the Hispanic neighborhoods, with education behind it. So I'm a big proponent of education, but it has to be on a level that people can understand. If I'm always talking over your head, what good is it? And then we do this, and I call it the bobblehead, and people are respectful. And so that's the other thing. Until you actually get it, we have to make sure that we're giving you the right message.
Mm-hmm. Bernice, I'm curious to find out what you think about that.
Can you repeat the original question?
Well, just making sure that we're on the same page here, because next week I think this issue is going to come up.
Yeah.
And our protocol right now, I think we're 1A or 1B, and that's 65 years old. And what I'm saying is, from an equity standpoint, should we tweak that a little bit? And I'm 62. And I got high blood pressure, and I'm a Black person. And so should I be able to get it now?
Yeah, I think we definitely have to consider the population who is most at risk, because that's an important factor. And then I also wanted to say, I was thinking about this as well, that not only do we not have grocery stores within certain communities, we don't have the financial means to buy the things that are healthier. And so we have the convenience store food and things of that nature. I try to eat pretty healthy recently, right? And it's expensive. It really is. And so we have to consider so many factors. But to your point, I think we need to pitch it really hard, and the importance of it. And I will say that once you get the vaccination, you feel different, you walk different, you move different. You still wear your mask.
Well, you got confidence.
You have confidence, and you feel protected. Not invincible, but you certainly feel protected. It gives you a different sense. It really does. And everybody that I see in here that has been vaccinated is nodding in agreement. You really do feel like you were able to do something. So many of us felt helpless, which turned into hopelessness. And this has given us some hope, and that there may be an end to this.
And I'm curious to find out what Marcus and I were talking about earlier from you. What have you heard in terms of hangups and some of the myths that are out there? And what do you say to people when you hear it?
Well, I refer first of all, what I hear is that people are afraid of the side effects of that. There may, 5 years from now, I may have a third eye, just all kinds of stuff. And what I say is, without being vaccinated, 5 years from now, you may not be here. And it's often, and unfortunately, is not until people lose someone that they really understand the devastation of COVID-19. It is devastating. And not only that, when you have family members that you can't see in the hospital, people who are asymptomatic, going around others who, they're at risk. And so this is really, really serious. It is about using our personal relationships to educate, to correct misinformation, to encourage. I am about giving people the voice, or allowing people to have the voice to make the decisions that are best for them. But life is valuable, and I don't want people to miss it before it's too late. And so, so that's where I'm at. I try to correct, advocate, and I just want to see everyone take advantage of the opportunity to be vaccinated.
Yeah. We are just about out of time, and just to make sure that we have accomplished what our host, Mr. Allen, has wanted us to do. You've been taking all this in, you've been looking online at different comments. Do you have anything that you want to impart or ask the panel or members of the audience that hasn't been answered or dealt with. Okay. Mark. Oh, you had a question? Oh, wait. Oh, we have a question from the audience. Yay! You don't know how much I just wanted to run back here and do this. So let me revel in that.
I just wanted to ask, what do you think is a solution that we can maybe combat miseducation and just information on social media? I've ran across a couple leaders. I work in a clinic, and I had two nurses tell me some information that they found on Facebook about the COVID vaccine.
Two nurses.
And I'm like, you are a nurse. You know, you are your job is to take care of people and educate them on what's right. So how do we combat that? Do you have any?
So school teaches us to find scholarly sources and fact check everything that we see. So that's one thing I've learned through my 3 years of being at Methodist. It's like drilled in my head. I cannot not find a scholarly article for something. But I think just a simple like caveat to tell people when you hear something like, oh, I saw this on Facebook or I saw it on Twitter, be like, well, have you found something else that supports that? Or have you seen like their sources that they said? If not, then I would just recommend researching it yourself. Like, I think we've become lazy with receiving information. And I think it's easier to see something on Facebook versus going out there and finding it for ourselves. And then the funny thing is that it's really not that hard. I mean, the CDC is a fact-based, website that has all accurate sources, Mayo Clinic. And I mean, I think doing little things like that can kind of re-encourage us and other people to find like good sources and like actual information.
I couldn't agree more. The first thing I was going to say, where's the evidence? And so often we all have computers. I always forget I have a computer in my hand. My son is like, just look it up. I'm like, oh yeah, but it is true. We all have computers in your hand. Look it up. Is it reputable? Are there resources behind it? And then you can check those resources. So, I mean, it's just, you'll hear a lot of things. I tell people, just get off Facebook. Go watch a Hallmark movie, because people are depressed because of Facebook, but look at the evidence.
Ooh, almost took everything off. I want to echo the sentiments from these two as well. From a personal standpoint, it is doing your own research. I think it's so funny, and we've all seen it. If you got Facebook, we've all seen it when there's simple questions like people that jump on Facebook like, what time Walmart closed? It's like anybody that tells you is going to Google it and put it in the comments. So it's incumbent upon ourselves to take responsibility and advocate for ourselves when it comes to getting the right information and doing the research. So that's number one on the personal level. But what needs to be done, I think, on a bigger level is in part the responsibility, I think, of the institution of medicine and the government. I say that because like I had a conversation a while ago, and we were talking about not only COVID vaccine, but even the flu vaccine from before. And they're like, you mean to tell me in America where you have a heavy population that don't believe it's the right for individuals to have access to healthcare, and people fought tooth and nail to make sure that everyone didn't have the right to access to healthcare, and you have to fight tooth and nail for prescriptions and things like that. But then when I walk up to Walgreens, there's signs everywhere saying free flu shot. You mean to tell me that the country that does not want me to have free access to healthcare is going to give me a free flu shot? Something seems fishy about that. And I think that is the sentiments and the mood of a lot of people in the Black community, because it's like, you guys don't want us to have anything but a life-saving situation. Like, you're going to provide it for absolutely free. Thanks, but no thanks.
There's a lot to what he just said there.
And then handed me the mic.
And then, right.
Okay, so again, I go back to seeking the education, making sure we understand the education. And really recognizing what's at risk. You know, I get it that free doesn't always seem free, but in this case, with this vaccination, free means alive, alive. You know, and again, I'm an advocate for the vaccination. I understand the history. I was one of those people that in the beginning was like, remember Tuskegee experiment? I was one of those people until I really started to pay attention and did my own research. I looked at people, particularly when the vaccination started to roll out, and working with patients. I was one of those people that were, you know, able to get it early on. But I looked at those who went before me and what they were willing, what risks they were willing to take. And I thought, you know what? Because my legacy, I hope, is making a difference in this world. And if that means I'm sacrificing myself by getting a vaccination, then that will be my legacy. But again, it is about which risk is greater? Which risk is greater? And it's not worth it. It is not worth it. I get it, but we really, all of us, I believe, have a responsibility to pull our family members in. It's nothing like burying your mother. There's nothing like burying your father. There's nothing like talking to what I do every day to a 15-year-old who is doing her best to try to get, you know, her schoolwork taken care of remotely, and then her mother dies. And we're having a debate about whether we should get vaccinated or not. Ask her, you know. And so again, it's those stories that really drive me to do everything that I can to advocate for making sure that we not only have access, but when we do, that we take advantage of that access.
Okay, yes. Yeah. Okay, we're out of time. All right. So no, that's so. I'm.
You mentioned earlier, what have you heard in the community regarding to the vaccine? And from like a lot of my friends and people that I go to school with, that I've heard is like they don't want to be a guinea pig again. They don't want a repeat of.
They don't want to what?
They don't want to be a guinea pig to like the vaccine, and like they don't want to be a test subject to like what are the side effects, which are understood. But one of the ironic things that I noticed when I got my vaccine, and that I tell people to this day. So like my manager offered it to me and I said, yes, of course. And I went up there, and I was actually part of the first group of people in Peoria to receive it. I think I got on a Tuesday when it first came out. The majority of people in line to get it as well, though, were white doctors, were white medical students. So I wanted to like just acknowledge, and like I try to tell people not to like reverse the irony in it again, So I was like, well, if they're gonna get it, I think it's good for me to get it as well. And I think it's good to put that out there that like I saw a lot of people getting it that were different colors than me.
And there was a Black lady who I think was one of the lead researchers to develop it. Yeah.
A couple more points and I promise I'm done.
Oh, that's fine.
I give you my so a couple things. Ms. Bernice mentioned health and how expensive it is to eat healthy. And I think a lot of us are figuring that out because I've just seen from social media that a lot of people are trying to figure out ways to eat healthy. But one of the conversations that people are starting to have and that I've had with other people too is just the doctor visits when it comes to anything that we have going on with us. It's quick to the prescriptions and nobody's asking, what are you eating? And we're starting to learn more and more that your health has a lot to do with what you put in your body. And it makes common sense, but we don't never think about it. And we're never asked about that when it comes to the doctor's office. Now, and I don't want to throw race in it in this regard, but is it because I'm Black and I've never been asked about my health? And maybe my counterparts might have been, I don't know, because every time I go to the doctor, I go by myself. So I don't know. But so you have that thought where it's like, we're finding out that we can do a lot of holistic healing. And sometimes we may over depend on holistic healing, but this just goes by the conversation that you had and the people that you know. And then even, and I hate to bring rap back into a Big Sean just recently released an album, and he talked about how he had a heart condition and they've been giving him these pills and pills and pills. And then a holistic doctor said, take some manganese or something, and it cleared it right up. And so you have people, again, going back to who's delivering the message, you have prominent people talking about, doctor told me to do this, I did something else, it worked better. And so now people are like, all right, well, it goes back to that distrust of the actual medicine. And then you got so many commercials where it's like, take this pill, take this pill, take this pill. And then 3 years later, Have you or somebody you know taken one of these pills and suffered, died or something like that? You could be part of a lawsuit. So it's like, okay, so I don't want to deal with that. So I'm just going to stick to myself. And then lastly, I think some people, and I'm of the mindset personally, I'm not saying I'm not going to get the COVID vaccine, but I would really enjoy like a COVID EpiPen. It was like, like, you don't have to take it right now because we're not ready to take it right now. But if come to find out I got it, boom, pop, you're good to go. So I don't know if that's coming, but
this is where on those award shows the music starts playing.
In all seriousness, the last thing I'm gonna say with regard to the Black community is Dr. Sebi when Dr. Sebi died and he was speaking of holistic medicine, there's a lot of rumors and a lot of dialogue going on as to why he died, or was he killed? Was it because he was preaching holistic medicine as opposed to synthetic pills and things like that? And so people are still having those conversations. And so the thought of the COVID vaccine, and you bring that into the picture and diet, I think that's a lot of the trepidation. So I'm done.
No, that was great. I mean, Dr. Sebi, that's a lot of people were following him. And so you're talking about compounded distrust. We already have this negative history. Then you got, experiments and guinea pigs, and now, yeah.
Hello, my name is Christian. I got here a little late. I wanted to know if there was if you guys had statistics on the survival rates for people who do not have or who haven't got the vaccine.
Survival rates for people who have not gotten the vaccine. No?
We get a weekly, I think, email from PIA, and it told of all the cases in Illinois and all the deaths, and it also spoke about our Peoria, Tazewell, the surrounding counties, and I calculate that every time. Now these people died probably prior to the vaccine because we just got the vaccine. And we're at 1.78%. I calculated that this morning. I know that sounds kind of nerdy, but that's all I really know.
Mm-hmm. Mm-hmm. Was your question, was it to inquire as to some comparison between somebody who gets the vaccine and their rate of survival compared to if they got the vaccine and died? Is that where you were going with that?
No, I was just curious.
Okay.
It wasn't to compare. But of the 1.8, were they older adults, younger adults? Do you have the demographics on those? Okay.
Okay. DeMarcus had me thinking because, Hank Aaron died, and shortly afterwards, there was a report that came out that he had gotten the COVID vaccine. And so imagine if you're already thinking cynical, skeptical thoughts about the vaccine, and then this great figure dies, and then it's like, oh, he just took the COVID vaccine, and now that's just, confirmation that it's, something's funny with it because he died, but I think they had, medically, they had said, his conditions were, the COVID vaccine had nothing to do with his cause of death. So you're going to find what you're looking for, right? Sometimes, yeah.
I just wanted to add to that real quick. If you ever got sick, okay, I ate a McRib from McDonald's many years ago and got sick. I will never, ever eat another McRib. But I attribute that because it had to be the McRib that made me sick. And I think that's what we do. If something happens after something, it had to be attributed to that instead of looking at the other pieces. So exactly, if somebody gets sick after they get the flu vaccine, it had to be the flu vaccine. it's a dead virus, which means that it's not going to get you sick, but that means you may have been exposed previously. And so even understanding that history of exposure and figuring out that line sometimes can ease your mind. It doesn't make you feel better, but it can help you understand that that isn't what attributed to your illness.
Yeah. And so in conclusion, what Dr. Hardy is saying is that Hank Aaron died from eating a McRib.
Absolutely. Don't eat a McRib.
Okay. So thank you so much. Would you clap your hands like this? Thank you, thank you, thank you. Andre, I think we're done.
All right, thank you. Let's give it up for Garry Moore one more time. Yes. Let's give it up for our distinguished panelists one more time. Appreciate it. I know this is definitely a very sensitive topic, so we appreciate your vulnerability today. Those who are watching, please make sure you take the post survey. I did repost the link at the very end of the chat, so please take that so that way we can measure the effectiveness of our events. Please be on the lookout for future DEI events. You all take care and stay safe out there.
Thank you.